Recording.
Did you know that 1 out of 8 couples will struggle with infertility in their lifetime? And did you know that according to the National Infertility Awareness Organization, Resolve, that only 15 states require insurance to cover infertility treatments? I have been personally struggling with infertility for the past year and a half. And that's why today I want to discuss with you what infertility is, treatment options, and reasons insurance companies should cover the treatment cost. Let's start by understanding what infertility is. From the article Infertility Insurance Mandates, author Lucy Smith describes infertility as a disease by the medical community of the reproductive system. Infertility is when a couple has been struggling to conceive for over a year without success. First, there's diagnosing, and diagnosing can actually be very painful for the woman. There are 3 types of tests usually involved. There's an HSD, which is a dye that they use to track the tubes to make sure there's no blockage. There is a hysteroscopy, which is a small camera is inserted to check for endometriosis. And thirdly, there's blood work to check for hormone levels to ensure a woman does not have any diseases like polycystic ovarian syndrome. Undiagnosed infertility can actually lead to much serious health problems. First of all, there's polycystic ovarian syndrome, which can lead to heart disease or heart attacks. Second is tubular pregnancies brought on by endometriosis. And third, if left undiagnosed, infertility can actually lead to thyroid issues. Now that you know a little bit about what infertility is, let's look at a couple of the treatment options and their cost. The first is prescription medication. These medications consist of Clomid, HCGs, and Metaphors, usually either a pill or a shot. Prescription medications can range anywhere from $5 to $1,000. The second type of treatment option is an intrauterine insemination, which is also known as artificial insemination. These price ranges anywhere from $400 to $2,000. The third and most successful type of treatment is called in vitro fertilization. In vitro fertilization is also the most expensive. The prices range from $10,000 to $20,000 per cycle. Lucy Smith, from her article, Infertility Insurance Mandates and Fertility, states that treatment for infertility can be extremely expensive. Some of the less invasive therapies, such as hormone therapy, can range in cost from $200 to $300 per cycle. Tubular surgery to treat endometriosis ranges anywhere from $10,000 to $15,000, and in vitro fertilization's average cost per cycle is $12,400. Now that you know a few procedures and their costs, let's discuss insurance coverages. Leslie King, from the Politics of Reproductive Benefits, states that 85% of infertile couples are treated with surgery, fertility drugs, and/or artificial insemination. However, only 38% of employers offer some kind of infertility treatment. There are 2 types of people for the law. There's those that oppose it and those that are for it. Those that oppose it first like to argue that adoption is a great option for people with infertility, which it is, but adoption prices range anywhere from $35,000 to $100,000. So women that cannot even afford the $10,000 infertility treatment, adoption is not normally something that they can consider. The second is the rising coverage cost. Now, most companies that offer infertility treatments, it's actually something that you elect to choose. And a lot of companies would offer it if they were asked by somebody if they could offer infertility treatments. Now, for those that are for it, are first of all saying that infertility is a given right. It's a given right to be a parent. So they should have this available for treatment options. Second is that it's a medical disease that has been diagnosed by the medical community, but it hasn't been treated as a disease, as most other things, as cancer is treated as a disease. It has a different stigma related towards it. Third is to look at the cancer patients. Normal cancer patients that undergo chemotherapy are usually left infertile after it. If insurance coverages helped the cancer patients, they would be able to later down the line maybe freeze embryos and have this option available for children if they want to pursue that. As Mark P. Trollis, an MD, a reproductive endocrinologist in Winter Park, Florida states, patients shouldn't have to beg, borrow, and steal to become a parent. Now this concludes while it's important for insurance companies to include fertility treatments because it is a medical disease. Today we talked about what infertility is, treatment options for infertility, and why it should be covered under insurance. It's important to remember that infertility can affect anyone at any time. Thank you.
5:32. Perfect.